everyone, welcome to Mom Docs, or Mom Talks. See, we do so many mom things around here, it gets confusing. It's Friday, we're happy to have you with us. I am joined by my shirt twin and good friend, Dr. Emily Hunt. She's one of our pediatric dentists here, and we are talking today about teeth and your child's first dentist visit and keeping your smile nice and bright when it's time to go back to school. So let's start by talking a little bit about what you do down here. You're down here in the basement level of Children's.
Yes.
And let's talk a little bit about the work that's done around here.
Absolutely. So the dental clinic here at Children's is definitely unique. So there are 3 pediatric dentists. So pediatric dentists do additional schooling. So we go to dental school and then we do 2 additional years to specialize just in children. The 3 dentists that are here, what makes us unique is that our clinic only sees medically complex children who are followed here at Children's. So most people are very confused when they say if you work in a hospital, but
Sure.
some of our patients here have a lot going on medically.
Absolutely.
And they also need a dentist. So, and many different syndromes and diseases have teeth complexities as well. So we just manage those here, and there are a lot of patients that I'm happy to work with the physicians here at Children's to take care of.
Cool. And one thing that all kids have in common is the need to go to the dentist.
Correct.
Absolutely. So let's start by talking about a child's first dentist visit.
Yes.
So let's start for when do I even get started on taking my child to a dentist?
So the American Academy of Pediatrics and the American Academy of Pediatric Dentistry and the American Dental Association all agree that the first dental visit should be at age 1. And many people look at me in horror about
I'm
this.
one of them.
Because they're like, my 1-year-old will never do this. And so we'll talk about how we can make this happen for a 1-year-old. And if your child is 1 and you haven't gone, don't mom shame yourself. It's totally fine. But the reason why we want a 1-year-old visit is to start developing those relationships. As many of you know, when you go to a pediatrician, there are a lot of things to talk about. And teeth are often something that just doesn't get in the mix because there are so many other things. So by forming a relationship with your dentist or pediatric dentist, that allows you the opportunity to not go in when there's an emergency or a problem. You want to have that relationship and that comfortable feeling when you can go to them and have that relationship already.
Okay, so beyond having a relationship, what's the benefit of starting your kids off so young? I mean, I'm trying to even remember if my daughter had all her teeth by then.
Right, and they shouldn't. So that's the thing. When a child is 1, they don't have many teeth. So the visit is very short, admittedly. But what it does is it answers all of those questions. So we talk about diet and what's going on with diet. So yes, you talk about that with your pediatrician, but you also talk about those things with the dentist and what's tooth friendly, what's not. Bedtime habits, and also how to brush your teeth. Many 1-year-olds are not the easiest, and they want to do it themselves. 2-year-olds and 3-year-olds as well.
We were just talking about, we both have 2-year-olds.
So
We were just talking about that.
They want to do it themselves, and so learning the appropriate amount of toothpaste, what kind of toothpaste to buy, how to deal with teething, and all of those things. So it's honestly more of a conversation with the parent and becoming a member of your health team.
Sure.
To make sure that it's developing a relationship, but it's also desensitizing the child. So many people tell me when I tell them I'm a dentist that they hate dentists. It's honestly something
She's
people
not
say.
scary.
But they do. They say, oh my gosh, I hate dentists, and then they open their mouth and show me their tooth. But what often happens is when you have an early introduction, by 3 years old, they actually are a cooperative patient. But it's gradually getting them accustomed to it. So when they're 1, we don't expect them to sit in the chair, lean back, open wide, and get their teeth scraped. That's just not realistic. And like you said, there's not all of the teeth there. But what we can do is expose them to the environment and the people, and then they gradually will be cooperative, especially when there's a problem. The other thing is that we can see the development of the teeth. So we can see if there are missing teeth, if there are any cavities or any teeth that are just not forming in the way that they're supposed to, just like a well check at a pediatrician's office.
And you do a few things to help kind of alleviate a child's concern. You keep mom and dad close. So can you talk to me a little bit about how you make this a little more kid-friendly?
Yes, so the first thing is it's called Tell, Show, Do. So we always introduce what's being done. So oftentimes with a 1-year-old, I don't use the fancy equipment that's back here. We use a toothbrush. And hopefully parents, once the first tooth is in, the child is accustomed to, or at least knows what a toothbrush is.
Sure.
And it's amazing. You show a kid a toothbrush, they often open their mouth. But here's the thing, is if a kid is terrified, they'll scream, and that's also opening their mouth, which sounds kind of terrifying, but it's actually helpful. So the other thing is that when they're this young, we have a parent. So this is something that most pediatric dentists do. It's called a nudity. This is my monkey, so that we can demonstrate what it looks like at most first exams. So I always attempt first to have the child just sit on mom's lap, and we see if we can get kiddo to brush their teeth. Mom's right there, and we can help. So mom may hold hands, and we're right here talking to them. They're not leaning back. I think many kids don't like that feeling of not having control. And so they can sit on mom's lap, and we try to brush their teeth and crane our neck a little bit to do the exam. A lot of kids, though, especially before the age of 2, are fighting, and no one can control. So the next thing we do is something called knee to knee. So child faces mom with one leg on each side, and the kiddo just leans back, and mom holds hands. Now the cool thing about this, and monkey may be screaming, but mom can see everything. So it's a really great way to show mom what's going on, and it's the best opportunity for her to see what's going on. So this gives us the opportunity to get in and brush. The other thing is, this is actually a good way of brushing teeth at home. There's a stage that every kid goes to where it's just tough. So if you have a partner at home that can help you, it can even be an older sibling to do this, it's super helpful. So that's one thing that we do in the office for kiddos who aren't ready to sit up or sit in the chair by themselves. So that's one thing, and that's the big thing is right away when you sit them up, mom can hug. And so it's that comforting
right away. All right. Okay, I'll let you put him back. So as your kids get older, start school, how often do you recommend a child come in and see the dentist?
So there's 2 answers to that.
Sure.
So we say every 6 months to check and make sure everything is still looking good. Baby teeth actually have a thinner outer layer than permanent teeth do. So everyone, basically because of insurance, goes to the dentist every 6 months. But with kids, it's really, really important because that outer layer of enamel can break down much quicker than an adult. So we want to make sure we get in there and check things and catch things early so that it doesn't cause pain. So every 6 months is the answer. But there are some kids who have a very high risk of getting cavities. And your dentist may say, I would like to see you more often, and that is okay. And that actually means they're a really good dentist because they're evaluating your child based on their risk rather than just when they can get paid.
So when you're looking at a child's teeth, let's talk a little bit about a school-age child who's heading back to school for the fall. So what are you looking for?
So when they come back, the first thing that we want to look for is if there's any missing teeth. So that's the first thing. So when we look back, we want to make sure there's no missing teeth. But even before that, if there's any pain. I mean, that's the first question that I always ask. Are you in any pain? Because the number one reason kids miss school is dental pain.
I bet you guys didn't know that, because I didn't know that for sure.
Yeah, so we want to make sure there's no pain, and if we can make sure and address that first, that's great. Because if you've ever had a toothache, it's terrible. I've had tooth pain, it's awful. So that's the first thing. And then we check for missing teeth, we check for cavities, and then we try to do x-rays. But it's really dependent on what the child will do and how we can work together.
So one thing that I learned from you in the last couple of months is that cavities are actually contagious.
Exactly.
So let's talk about what happens if your child has a cavity.
So if your child has a cavity, there's a lot of different things. So first of all, a cavity is a hole. It is a blatant hole. The disease process itself is called caries, and so that's the bacteria and the actual formation of the hole. So if your child has a cavity, there's a couple of things. One, if the tooth is going to fall out really soon, the dentist may say, let's just let it go. And that's okay. That's not neglect or anything. It may be a tooth that we just let go. The next thing is that we sometimes do something that's called silver diamine fluoride. So I'll go from like the least aggressive to the most aggressive type of treatment. So there's this thing now where it's called no drill dentistry, and they've had it in different publications. And what it does is it's a paint that stops cavities from getting bigger. That can prohibit it from getting larger. The problem is it turns the cavity black, which may not look so great. The next thing, and honestly the most ideal thing, is to do a filling. But to do a filling, you have to sit still. Now, if you work with a dentist that they've developed that relationship with and that trust, we can often get that done. That's one thing that I will say is pediatric dentists tend to be very quick. And so because we're faster at getting things done, I would say that is our claim to fame. There are other options of helping kids to cooperate. One of those things is nitrous oxide. But nitrous is really only beneficial if you have a cooperative kid already. So a little anxious child is fine, but a child who is not even going to lay back may not work with that. Another option, so many of our kids here have been stuck and prodded and have seen a lot of doctors and really, quite frankly, don't like any of us. And so sometimes the best option to treat things and to maintain a level of trust with us is to actually have surgery, which is general anesthesia. So if you have one cavity, that may not be the best option, but if there's a lot of cavities going on and there's a lot of pain, the fastest and sometimes safest way to get things done is that route. So there's many different ways and I guess tools in our toolbox to complete treatment.
Good. Now, as we're starting to get into the teenage years, I know that question probably gets to you a lot, is what about braces and being recommended to an orthodontist?
So the orthodontists, they basically all agree at 7 there should be an evaluation. So even before the teenage years. So there still are some baby teeth at that time. Most kids around that age have lost many of their front teeth but still have those back baby teeth, and that's a good time where we can start evaluating to see the development and how things are starting to fit together. That doesn't mean that every child needs braces at 7. It's just a great time to have that evaluation. And so different orthodontists have different philosophies. So I always recommend talking to multiple orthodontists for a consultation just to see what works with your family and also who you have better rapport with.
Absolutely. So as a dentist, orthodontist, two very separate things.
Kind of. So an orthodontist is a dentist. That is one thing that I think people get confused with. But just like as a pediatric dentist, I did additional training, an orthodontist does additional training. However, orthodontists aren't going to fill your cavities. So if you're going to an orthodontist and having braces done, they're not going to do your cleanings. They're not going to fill your cavities, and they're not going to do those assessments. So it's very important when you're seeing an orthodontist to also have an additional doctor.
So let's talk about as your kiddos are getting older and things like that, what are some things you can do at home to help oral health? I mean, I know brush your teeth, but what else can we do?
So one thing that I feel like we always talk about is, what does your child drink? Yeah. And so everyone says they never eat candy. And then I ask, well, what do they drink? And almost always, it's never water if we see cavities. So the big thing is that you want to make your mouth a neutral environment. What that means is we don't want our mouth to be acidic. So sodas and juice and sweet tea makes your mouth more acidic. And it feeds that bacteria, which is the contagious part of cavities. So the best thing to do is to neutralize your mouth, which is to drink water.
Sure.
So it's fine, to have candy every once in a while. It's fine. Everything within moderation is okay, but you want to get your mouth to be at a neutral level and just clean it with water throughout the day. So if there's one thing that you can do to help your mouth, is to drink water.
Hey, adults too. So.
And that's the big thing, is kids love copying their parents. And so if you yourself drink a lot of soda, I'm not trying to say don't drink soda, but your kids are going to want a sip of that for sure. And I'm guilty, especially with coffee. So, and so if you can drink water to help neutralize things, your kids are going to do that. And that's also what's accessible at your home then too.
Great. And so what about flossing?
So flossing is something that you can start introducing to your child, honestly, when you feel that they're not going to really be upset. So for instance, my kiddo, all of his teeth are open. They're not touching. So I don't floss him. And he doesn't have his 2-year molars yet, so there's spacing everywhere, so his spit cleans things. But I have flossed him before just to get him introduced to it. The time period when it's important is when teeth start touching, and every child is different. So some kids, right when those front teeth come in, they're already touching, and so they're going to need to be flossed. And I know that seems crazy to have to floss your 1-year-old, but some kids actually need that because those teeth in between, especially if they're consistent milk drinkers, that can happen. They can get cavities, and I've seen cavities in children that are 1 year old. So that's why we do like seeing them young. And because it depends on the shape of their teeth and how you can clean them. But it's really important that everyone start flossing their teeth by about 5 in the back. That's the latest. So it depends on when those 2 molars actually touch. Once those back molars start touching, and when you floss them, you can feel a tug, that's when we recommend flossing for sure. So the only way to know if they're touching is to practice flossing.
Sure. So let's talk about one last thing. So what if, like, I'm a parent, I'm like, we're busy, we've got sports schedules, we've got school, let's get the dentist this year, let's say.
Okay.
This year. So
Okay.
what do parents and kids run the risk of happening if they don't keep up with these visits?
A couple of things. The biggest thing is pain. So pain and cavities. Like I said, in children, cavities spread quickly. So that is my number one thing. The second thing is trauma. So many children fall on their face, right?
Yep.
Okay. And so your kid may fall when they're 2 years old and bump their front tooth. I feel like every kiddo. The tricky thing is trauma can happen to a tooth and no pain occurs for years and years and years, and then out of nowhere, you can get an abscess. So what we do at the dentist is try to take x-rays and evaluate things and catch them before pain occurs. That's really the big goal. And the other thing is just to make sure that we can keep things developing and catch things when we need to go to the orthodontist, or if there's any other intervention that needs to occur based off of where teeth are developing.
Sounds good. Emily Hunt, thank you so much. That is going to wrap it up this week for Mom Talks. You almost did it again. And so this also wraps up our series on health screenings. Next week we begin a new series that is kind of part 2 of a journey you're going along with me. So you may remember I did one on pregnancy before the birth of my daughter. She's 3 months old now. I'm back at work. And so we're going to be talking about the 4th trimester and being a new mom. So next week we're going to be meeting with Dr. Cameron Crispin-Robbins, who you may remember if some of you watch Belly to Baby or have followed us here. We're going to be talking about this 4th trimester. So what is that? What does a mom need to know right after having a baby? We're also going to be covering things like exercise after having a baby, kind of getting that body back. We're going to be talking about safe sleep for your infant. We're going to be talking about going back to work, even a little bit about mom guilt. It's real. It happens. So I hope that a lot of you will join in with us next week at 11 o'clock on Fridays. We'll see you later.